Good afternoon, everyone. Thanks for joining us. We're going to give it a couple minutes to fill the room up here. Good afternoon again, everyone. We'll give it about another 30 seconds here or so to fill the room up. Give it just a few more seconds here. Good afternoon, everyone. Thank you again for joining us for our weekly Wednesday webinar series. My name is Brett Spitali. I'm the Vice President of Advancement here at the National Hemophilia Foundation. On today's webinar, we will discuss the 10 things you need to know about cannabis. Please feel free to ask any questions you may have by using the Q&A feature at the bottom of your screen. We have NHF staff members monitoring these questions, which we will present to our speaker after the presentation. Please note this webinar is being recorded and will be available to the community beginning on Friday, April 21st. Today, I'm joined by Dr. Swathi Varanasi, integrative health pharmacist and medical cannabis expert. Thank you for joining us today, doctor, and I will turn it over to you to get us started.
All right, wonderful. Can you hear me?
We got you.
Yes. Okay, awesome. So thank you so much for having me. I'm really looking forward to this discussion, and even leading up to the discussion when I was interacting with quite a few of the members of NHF and the staff, they actually sent over some data that was recently collected from a lot of your members about, what they do know about cannabis, whether or not they use cannabis, and that was actually really helpful. So I want to just say a thank you to the NHS staff that I've interacted with thus far for providing me that insight, because that really helped me craft my slides for today. But then also to just being able to be here and share this information is really important to me, and it's a big part of my mission. So, alrighty, so I'm just going to jump right in. So these are the 10 things you need to know about cannabis. All right, so a little bit about me. So, I'm an integrative health pharmacist. And so really what that means to me is I created this diagram on the left side of the screen, and it's all about all the different modalities of integrative health, wellness, and healing. And the way that I view it is this intersection and interplay of all these different, things that we can do in our daily life to really optimize it. And whether if we're looking at preventative health, curative health, anything in between, I really do think that it's about personalized medicine and what I call patient-centered shared decision-making. And at the end of the day, what that is working as a team. So me thinking of it as a healthcare professional, I want to work as a team and be a guide to my patient and be able to offer all these different options. So if, for example, someone comes to me and says, I'm having issue with pain, I'm having issue with sleeping, let's talk about all the different possibilities and let's figure out what works best for you, your treatment goals, and your overall lifestyle. So for some people that might be herbs, for some people that might be walking, that might be running, that might be, like incorporating yoga. For some people, it's talking about mindful attention or mindfulness and meditation. For some people, it's using prescription medications and using supplements, maybe using one or the other, both. And at the end of the day, for me, it's really about what does the patient want and how can I help the patient achieve what they want to achieve and lead the life that, makes them feel like the best version of themselves. So that's a little bit about me and the way that I view health and wellness. I am the, first ever integrative health trained resident in the US. And so it's something that's been very important to me is not only being a part of the patient journey, but also helping to educate, whether it is a provider, it's a patient, it's a consumer, whomever it is, to really help them understand about these different modalities, how they are based in science, how there is research to support them. Because at the end of the day, I'm a healthcare professional, I'm a clinical researcher, I'm an academic at heart. And so it's really important to me that we talk about the science and really that all of this is rooted in something very objective and incredible. And so much of this research as well is ongoing. So that's a little bit about me and just a few things just to really cue up everything to come that I really do believe in the power of all these different modalities. And I think for most people, it really is trying to figure out what I call the benefit versus risk ratio. It's one of the top things I learned in school, is really thinking about, all right, how can we optimize benefit while decreasing the risk in every single decision that we make for a patient? And so for me, that's looking at drug interactions. It's looking at how can we add certain supplements, or maybe how can we take away certain medications, but it's really figuring out what is the best course of action for this patient, depending on what they want to, what they want to get out of the treatment. All right, so jumping right in. So what you need to know about cannabis. So as I mentioned, I'll be talking about 10 different things. These are based on some of the research that I was provided from NHF. It's really about the basics of what you need to know about cannabis. And then from there, we can talk about, and I would love to answer any of your questions about how cannabis in particular can be used in patients with, or people with bleeding disorders. So the first thing is that cannabis is not new. I know that it might seem like, cannabis popped out of left field and, it's something that's brand new to the sphere, but really it actually, the research and the documentation dates back to thousands of years, actually originally in China. And then from China, it was brought to Eastern and Western Europe, later brought to Latin America, and then later brought to North America. And, in North America, in the United States, initially it was looked at, cannabis itself, as a medical agent or a medicinal agent. And so physicians were prescribing it, pharmacists were, formulating it, and apothecaries way back when. And all of this kind of came to a halt in 1937 with what was called the Marijuana Tax Act. And this was a lot of physicians coming together and realizing that, oh, this could potentially have abuse potential. Is there something that we can do to regulate it? And so this is why actually the DEA, as per years ago, put it into a category of what is considered Schedule 1. I don't know if you're familiar with those schedules or those, from a regulatory standpoint, but there are what are called schedules of drugs. So it's Schedule 1 through 5 are the ones that are the most heavily regulated. And currently cannabis sits in Schedule 1. Originally, when the schedules were created, it was to mitigate risk, especially from a consumer standpoint, from a patient standpoint, and also from a provider standpoint when they were, providing the recommendations to patients. So Schedule 1 really means that initially it was put together as a list of agents that only had recreational use. And so what that means is that, there's no real medicinal value to anything in Schedule 1. As we know, a lot of the different things that are in the Schedule 1, whether it is cannabis, psilocybin, MDMA, LSD, a lot of these things that sit in Schedule 1 that were originally thought of as only recreational, even though a lot of their history is rooted in its medicinal use. And that's actually how originally a lot of these things were used in the United States, like cannabis, they were put into this category of having potentially more risk than benefit. So it ended up in this Schedule 1. So now there's a lot of movement in deciding, should cannabis be removed from Schedule 1, maybe put down into a lower classification like 2 or 3, or even removed from the schedules overall. And you might be familiar with some other medications like SSRIs, for example. Some of those are in what's called Schedule 4. And then there are others, some of like the opioids and pain medications that are in Schedule 2. And this means that, they have lower potential risk of abuse, but they still have quite a bit of abuse potential, and they could have medicinal value potentially. So again, this scheduling system is very outdated, and a lot of people are working, lobbying for changing in the schedules, because as we see from current and previous research that's been done for the past few decades, that a lot of these agents that I recently mentioned, there actually is research to support their use in a medicinal standpoint. I wonder if, I think it just stopped the screen share. So let me make sure that.
I think we had.
Can you see my screen anymore?
No, not anymore, doctor.
No, okay, yeah. I just got a notification that the screen sharing stopped. Okay, 1 second. Let me open it up again. All right. Okay, so we are back. It should be good now. Please let me know if you see my screen.
Yep, we've got you.
Yeah, it's back. Okay, amazing. Yeah. Let me just click view slideshow. Okay.
Perfect. Thank you.
Yes, definitely. Okay, we should be good now. So that's really as where the DEA stance, or the U.S. Drug Enforcement Administration, is with those scheduling. But, as of 2018, one of the newest pieces of legislation that's, come across that's really changed a lot of things in the space is what's called the Farm Bill, or it was passed in 2018. It's also called the Agricultural Improvement Act. There were a lot of different parts of that bill that went through on a federal level. And one of them is that they denoted that certain types of cannabis, specifically hemp. So a lot of questions I get is, what's the difference between hemp and cannabis? So hemp and cannabis are very similar. They are more or less the same plant. However, they are breeded in different ways. So they have different chemical compositions, and therefore they have different active components. So cannabis is still thought of as, cannabis is used as the umbrella term that includes both cannabis and hemp. You might see, then, okay, what's the difference between marijuana, hemp, and cannabis? So cannabis is the overarching, again, umbrella term. And then if we delineate from cannabis and we look at, hemp and marijuana as two options, or two kind of branching elements from the term cannabis, really, they are very similar again. However, they have different chemical composition and therefore different active ingredients or active components to each of these kinds of plants. Again, cannabis is the whole plant. And so when you hear things like CBD, THC, all these different acronyms, those are specific cannabinoids, and we'll talk more about that in a bit. But again, yes, so to delineate between marijuana and hemp, marijuana is thought to have a higher percentage of the quote unquote psychoactive or intoxicating components like THC, whereas hemp is known to have higher percentages of CBD or cannabidiol. And so what the Farm Bill said was that hemp-derived products, so again, hemp being the one with the higher CBD, lower THC, as a very simplistic definition, that hemp products can now be sold in, grocery stores. They can have mass production and mass, sales throughout the United States. However, one of the things to note that they did make very clear is that these products that can be mass sold, again, not in dispensaries, not in particular states that require licensing for high percentages of THC, these products can be sold at, grocery stores and a lot of different other, specialty retailers. They can be sold there. And that's why you see so many new CBD brands as of 2018 after this bill, because all these different products are CBD. They do have CBD in them, but it also could mean that they could have up to 0.3% THC. And that is set by the Farm Bill. That percentage is the, gold standard on the federal level, but we'll talk a little bit more about what that all means very soon. All right, so the other thing that I already hinted at is that, as a healthcare professional, what's really important to me is knowing that, is there science out there about it? Is there research? And, what can we draw from a quantitative, objective standpoint to then make educated decisions for our patients or for consumers in general? And so I just wanted to mention the late Raphael Mechoulam. Dr. Mechoulam died recently, and he was one of the main people, really, he's called the father of cannabinoid or cannabis research, because he was the one that really helped to put cannabis on the map in terms of research. And a lot of his research was done at the Hebrew University of Jerusalem. And so Israel continues to be such a force for cannabis research, and they've really devoted so much effort and financial support regarding the use of cannabinoids and other botanicals too. But I did want to mention too, in the United States, there's the University of Mississippi, and University of Mississippi was actually the first national, type of entity that was publicly funded to do cannabinoid or cannabis-based research. And I realize I'm saying cannabinoid and cannabis, and I want to make a distinction of what those mean. So cannabis, again, is the full plant. And within the full plant, just as we think of any other plant, or I really like to think about it like a house, there's a lot of different components of a house. There are doors, there's windows, there's, plumbing, there's a lot of different things, right, that compose a full house. And so if we think of cannabis as a full house, there are a lot of different components that make up a house. And so I think of it as cannabinoids being, some of the active components, perhaps like the doors or the windows, they're a very integral part of the house. And so with these cannabinoids, like there are a lot of different ones. And so as of now, we know that there are about 200 studied cannabinoids, but those are not the only active components in the cannabis plant. There are also other active components that we'll talk a little more about. And so cannabinoid is a term that I use as an umbrella term for, the acronyms that you hear like CBD and THC. All of those are specific chemical compounds. You can see on the screen here where it says cannabidiol, and that's actually Dr. Raphael Meshulam years ago when he was teaching a class at the Hebrew University of Jerusalem. And so there you can see what the chemical structure looks like of this one particular compound, CBD. And for all the different, cannabinoids or some of the active ingredients in the cannabis plant, they, fall under this category of cannabinoid. And so we'll talk a little bit more about that in a second. So this is kind of leading into this, same idea that CBD and cannabis are not the same. As I mentioned, cannabis is the full plant, whereas CBD, as listed here on the screen, this is the same chemical structure written a little bit differently, but, that is one compound that's found in the cannabis plant. I also wanted to talk about some terminology that you might see on CBD products. Again, this is not CBD products necessarily you'll see at a dispensary. These are CBD products that you might find at a grocery store or at, a wellness center or at a gym or different places like that, because that is, as per the 2018 Farm Bill, that is why we're able to have these CBD products in places other than dispensaries, and also be able to have access to these products in a more robust way, which I think is really incredible. So on the right side, you can see these three different terms, right? Full spectrum, broad spectrum, and isolate. So what's really important to know is that all of these are different types of CBD products. And, they're called CBD products because that is one of the main components, but it's not the only active component. There are some products like CBD isolate products, like all the way on the right side, that are just CBD, and they on the packaging should say CBD isolate. When you look at the supplement facts label, it will say that the active ingredient in there is just CBD. Whereas we have broad spectrum and full spectrum. Broad spectrum and full spectrum, as you can see, I love this image. I did not create it, but I love this image that shows just the key differentiator, that full spectrum has THC, whereas broad spectrum has 0% THC. So, the main importance between the two is that if we are thinking about, this terminology being for CBD products, that THC, again, even if full spectrum has THC, it's only up to 0.3% THC. And this is really important because just because you see a product out, sitting, let's say at your local drugstore, and you see that it says full spectrum, that means that it does have THC, but only up to 0.3%. So a big question I get regarding, full spectrum, broad spectrum, and isolate is like, why would I choose one over the other? Part of that answer will come a little bit later in the discussion. But the other part of that answer that I think that's really important is, what are you planning to use it for? A lot of the reasoning why I would say using an isolate, broad spectrum, or full spectrum is like the reasoning behind why you would use one product over another is like for a condition, for a specific symptom. And then the other thing too is that, let's say, for example, you have a government related job and or like you're in school. For example, when I was in pharmacy school years ago, we used to get random drug tested. So I, at that point, would never be interested in taking something like a full spectrum product, because even though there's only 0.3% THC, which 0.3% out of 100% is quite a small percentage. But at the end of the day, those drug tests only look for active components of THC. So if you're, if you know that a drug test might be in your near future, or you're applying to a job that requires a drug test, or any of the above, then I would stand clear of any full spectrum product, because it is possible, even though 0.3% is very small, I always want to err on the side of caution. And I would say that do not go for a full spectrum product, because that 0.3% could potentially show up on a drug test, and you don't want your CBD products getting in the way of any sort of future career. So that's really important. The other thing too with drug tests is that if you are getting products from a dispensary, it's really important to read the label, because those products can have upwards of, a lot higher percent than 0.3% of THC. That is to say, not all products at dispensaries have THC, but a lot of them do. So you just have to be careful and ensure that you're speaking with whomever works there. And, I think the most important thing is, apart from even just speaking to people who work there, is ensuring that you can reach out to a healthcare professional. I'm happy to be that person and provide my email to the NHS staff to share to whomever would find it useful, to just double check all of this information before you go off and are trying different products that could potentially not be the right fit for you. All right, so more to come on all of that information soon. So again, moving forward, so number 4, I always say the C in cannabis is for complicated, because the way that cannabis works in the body is very complicated. And also in terms of components, I feel like the term CBD and cannabis, as I mentioned before, get conflated and get confused. And so I think it's really important to talk about what are the other components in the cannabis plant. So not only are there these active components like the cannabinoids, there are other active components too. So again, cannabinoids are all those acronyms: CBD, THC, CBDA, THCV, CBG, CBN, all those different 3-letter acronyms that you might see, on products, you might see in ads, you might see in a lot of different places. And so those are what are considered cannabinoids, and those are active components in the cannabis plant. But as you can see on the right side of the screen, there are a lot of other active ingredients too. On the top right-hand corner, this is from a diagram that I pulled, that I created, about different dietary phytochemicals. Again, we don't need to go into what that is, but the main thing is that, there are a lot of different active components in every single plant. And so if we think about cannabis, not only are there cannabinoids, there are also terpenes. So terpenes are referred to as the essential oils of the cannabis plant. I think that this definition doesn't do it justice, because, the essential oils, of course, we think of in terms of smell, in terms of, the feeling that it gives us, the scent that it gives off. But terpenes are much more than just the scent that they give off. And the thing too that is great about terpenes is that they're not just found in cannabis, they're found in a lot of other plants. So I have a diagram on the bottom right-hand corner of the screen where you can see the different terpene names like linalool, limonene, myrcene, pinene, caryophyllene. And below the names, you can see some of the plants that are where they're also found. So a lot of these are found in various cannabis strains, but they're also found in, like, myrcene is found in high percentages in mango and hops, for example. So if there's a high myrcene content in a specific cannabis strain or a specific cannabis product, then that means that there might be a smell of mango or something like that. So that's something good to know. But also the other thing that I really love about terpenes is that because, these components are active forms of, are found in active ways in a lot of different foods and spices and herbs and things like that, there's a lot of research to support their use. So things like limonene have been researched for energy and focus. Things like linalool that, you might even be familiar with, like, a lavender spray for relaxation or a lavender essential oil. There's a lot of great research to support its use to promote a great restful night's sleep, as well as relaxation. And there's a lot of different, ways that we can look at these different active components. So that's why another reason why I say cannabis is complicated is, like, there's so many active components, because even apart from these, there are other components called polyphenols or bioflavonoids, again, also active in a lot of different herbs and other plants. But this is why when we're trying to nail down, why we would use cannabis for XYZ reasons, whether they're conditions or symptoms, it's really important that we look at these individual components and how they can work and play together really well, because cannabis is a plant and there are so many different things that we can look at and different ways that we can use it for our benefit. And then on the left-hand side of the screen here, I have a diagram of what is called the endocannabinoid system. So this is a system you might not be familiar with growing up, and like, I did not hear about it. I didn't even hear about it in pharmacy school until a lot more of the recent research that has come out. So initially, it was discovered in the 70s by Raphael Mechoulam's team in Israel. And since then, there's been a lot of studies all over the world about the endocannabinoid system and how it works. I really like this diagram. I did not create it, but I really like it. It's from a textbook, really talking about where the endocannabinoid system is. And so as you can see, it's very vast and widespread throughout the body, which is quite different from a lot of the other systems that we are more familiar with, like the system associated with our lungs or the pulmonary system. That's pretty concentrated within 2 or 3 organs. Same with the system associated with our heart or cardiology. That's 1 or 2 organs, right? So it's very interesting to think about that. This system is so vast and widespread, and it really speaks to why the endocannabinoid system is directly or indirectly linked with a lot of different processes in the body. And this is because the endocannabinoid system has 2 receptors that we know very well and very extensively, much like a lot of the other systems where, we know about 2 or 3 receptors, that are directly related. And then there are a lot of other potential receptors that they might not be directly related, but they're indirectly related through a series of, biochemical cascade and reactions. So, for example, we have CB1 and CB2. These are the receptors. They're cannabinoid type receptor 1 and cannabinoid type receptor 2. The CB1 receptor is more closely associated with central nervous system function, with brain function, cognitive processes, all of that. And it's also associated with mood, of course, associated with the brain. And then the CB2 receptor is more closely associated with immune function. Again, this is a very simplistic overview, but CB1 and CB2 also have a lot of other benefits in other parts of the body. And so, yeah, as you can see, this is a great diagram as an intro to, where potentially CB1 and CB2 receptors are in the body. And, how that, when we incorporate CBD, THC, any of these cannabinoids into our daily life, this is how it works with the body, is with this endocannabinoid system. And the main goal of the endocannabinoid system, which I think is so beautiful and quite different from a lot of other systems, is really to promote this idea of homeostasis or balance. And yeah, homeostasis is just a complex, scientific term, but it really means that the endocannabinoid system wants balance for the system. And so if the endocannabinoid system is out of balance, a lot of this has to do with inflammation. And so the root of balance really is this idea of inflammation. So if there's unwanted inflammation, excess inflammation, chronic inflammation, so chronic inflammation meaning inflammation that's lasting a very long time for months and months and months, that could be a contributing factor to a lot of different disease states and a lot of different conditions. And so the endocannabinoid system really works to help help decrease a lot of that unwanted inflammation, which thereby indirectly can impact a lot of different conditions. And so I think that's why cannabinoids and cannabis in general has been researched and now, proven to be a great selection for mitigating a lot of symptoms and being a part of a comprehensive treatment algorithm for a lot of different diseases. All right. So the next thing is that our bodies make cannabinoids too. So this was one of my favorite things when I first started learning about the endocannabinoid system that really helped me relate on a science level of, wow, okay, so not only can we incorporate these cannabinoids from the cannabis plant, again, cannabinoids being some of the active components like CBD, THC, CBG, CBN, all those acronyms, but there's also cannabinoids we ourselves make on demand in the body. And I just found this fascinating because the two that we know the most about are anandamide or AEA and then 2-AG. So as you can see on the top of the screen, those two chemical compounds there, we actually actively make them in our body. And so these are generally created or synthesized in the body in response to an inflammatory marker, in response to, some sort of pathogen, whether it's, related to immunity. But the main thing with these is that they are created to help promote that idea of balance. And so, when these cannabinoids were discovered from the cannabis plant, so again, those are the cannabis, what are called phytocannabinoids, so phyto meaning from a plant, whereas endocannabinoids are things we make endogenously or in the body. And so, initially when this information came out about CBD and THC, which you also see on the screen, it was really fascinating from a science standpoint because the way that CBD works in the body is pretty parallel to the way that 2-AG works. And THC works pretty parallel to the way that anandamide or AEA works. So, just thinking about the way that our bodies are already in synergy with what's going on in nature is really, really amazing to me. And it really helps paint this beautiful picture of like, not only can we incorporate cannabinoids into our daily life, we can also do things on our daily life, even without incorporating cannabinoids, that can really influence the endocannabinoid system through the production of AEA and 2-AG. And I'll talk a little bit more about that closer to the end of the presentation. So then the next thing you need to know that I think is really important is that there actually are FDA approved products that are either cannabis derived or I call cannabis inspired. And so I have the few that are the top 3 here on this chart. This is also pulled from a textbook. The top 3 here, Epidiolex, Marinol, and Sesamet, they are all derived or inspired by cannabis. And so I say this because Epidiolex was recently approved in 2018, specifically for treating pediatric seizures. They're rare pediatric seizures. And so it has also since been approved as well in the use of these same seizures in adults. But the interesting thing about this one is that it's a CBD isolate. So again, isolate means that it's only CBD and no other of the active cannabinoids or components or terpenes that I mentioned. It's only CBD. And then the other thing that's also very fascinating to me is that the company that creates this, they actually have it plant derived, which is very different from the next 2 on our list, Marinol and Sesamet, or dronabinol and nabilone is the other terminology for it. And these are both synthetic THC. So they're either synthetic THC or synthetic analog. So what this means is that it's THC or THC-like, and it is created in a lab. So it is, the same chemical structure, same chemical compound, but created in a lab. It is not from a plant. And both of these medications were approved in 1985. So they've been around for a long time. And they were initially FDA approved for chemotherapy-induced nausea and vomiting. And then also Marinol or dronabinol was approved for weight loss in association with HIV and AIDS. So that was a later indication is what it's called. So indication is the FDA approved, use. And what is under guidance from the FDA for using these specific products. I do know that a lot of people have had these products prescribed what are called off-label. So off-label is, they're not technically FDA approved for these things, but they are able to be written in prescription form for patients for other uses. So those are the top 3 that I have listed here. They're all FDA approved in the United States. This textbook also included this 4th one, Sativex, which is CBD THC. It is a 1-to-1 ratio. Again, noticing that all of these formulations that I talked about until now are all 1 compound, but Sativex is actually 2 compounds of CBD THC, 1-to-1 ratio. It is an oral mucosal spray, which means it's a spray that is that's sprayed into a patient's mouth. And so this actually has been not FDA approved yet, but it is in phase 2 or phase 3 trials now in the United States. So I see that it will likely be approved within the next 5 to 10 years, specifically for treatment refractory multiple sclerosis spasticity. So very specific indication and use, but it's already being widely used in 18 or 19 countries now, and it's approved by those countries, version of the FDA. So I do see that this could be definitely something down the road that the US FDA will definitely be looking into and considering for FDA approval. But until that time, as of early 2023, we have 3 products that are either cannabis derived or I call cannabis inspired. And I say inspired because synthetic THC is not technically from cannabis. It's created in a lab, but the idea of utilizing this compound that does naturally occur in cannabis, I still think is a great step forward for the medicinal use and properties of cannabis. And then, as I mentioned before, one of the reasons why, like I'm going back a few slides now, one of the reasons why, I think full spectrum and broad spectrum are really incredible is because of, because of what's called the entourage effect. So the entourage effect is really what's listed on the screen here. It's also called the ensemble effect. And I love this diagram. Again, I didn't create it, it's from a textbook, but I love this diagram. And it's really talking about how all these different active components, again, you can see a lot of different 3 or 4 letter acronyms that are cannabinoids. You can see the term terpenes, flavonoids, all these different active components that are naturally found occurring in the cannabis plant, how they all can work in synergy and really work as a symphony, whether they're an ensemble or an entourage, because when they're all used together like this, it really does optimize the benefit for the patient. And it really means that oftentimes we can use a lower dose if we look at a lot of these different cannabinoids together, as well as these other active ingredients. And so, with this, though, what's really important to mention is that dosing is not a one-size-fits-all. And this is something that I find that is very frustrating from a provider standpoint, but also from a patient standpoint, is because of the biphasic metabolism. Again, a lot of complicated terminology, but it's really because of the way that cannabis is broken down in the body, it makes it very complicated about how to find the right dose per each person. Because unlike medications that are, 1 compound, and we research that compound for its specific use, and we understand exactly how it's broken down. And also we understand too, how it's going to work with different patient populations in a lot of these different research studies. With cannabis, as I mentioned, it has all these different active components that can all behave differently, can all be broken down differently, and can therefore be used differently. So when we're thinking about cannabis, it's a lot more complicated, as I said before, because, all these different things act differently. And so it's really important to, what I say is start low, go slow. Or rather, everyone says start low, go slow in the cannabis world, especially from a healthcare provider standpoint when we're dosing things. But even more important than that, what I add on to the end is stay low. So I say start low, go slow, and stay low, because I'm all about trying to find the lowest possible dose that's going to work for people, which is why I like the idea of broad spectrum, for example, because it has no THC, so I don't need to worry about any any potential, drug testing issues or anything like that. But it does have most of the active components with only the THC removed. So we can then optimize and lower the potential dose of all these particular active ingredients to then get to the best benefit for a patient. And so it's really important too, because most of the medications that we have on the market, we have an idea about what the dosing could be for a man, for a woman, for someone who's non-binary. We have an idea of what it could look like for, someone in a different age range. But what we don't really have for cannabis is this breakdown because of all these different active components, because medications are often only one compound or maybe two compounds. And so, but what we can do is we have a good idea, or a better idea rather, about the breakdown and, the use and the dosing when it comes to CBD and THC, and looking at each one of these components separately, because there is research to support the dosing and use of each one of these components. I still think there's a highly personalized aspect of dosing with any medication, or any herb or any particular component. I think that at the end of the day, a lot of the blanket statements that are created about dosing are not correct, and that's why it's so important to work with a healthcare professional who knows and has experience with dosing these particular alternative healing remedies for different patient populations, so they can help figure that out for you and cut out a lot of that needed patience of figuring out the right dose. Because just because a dose of 10 milligrams works for your cousin or for your aunt or for your significant other, you might need 40 milligrams, and there's nothing wrong with that. It doesn't mean that anything's wrong with your system. Some of it, as I mentioned on the first screen, with all the different modalities in that spectrum or in that color wheel, one of the things is genetics, and genetics plays a big role in the way that a lot of these components are broken down. And I'll talk a little bit more about that in a bit. So then the next thing that I'm going to talk about is, even though CBD is federally legal, states get the final say. This is important because if you remember, I mentioned about the Farm Bill. The Farm Bill is a federally legal piece of legislation that talked about the federal legality of CBD if it is derived from hemp and if there is only up to 0.3% THC. That being said, each state in the United States, the way that the government stands right now, states get the final say. So even though CBD is federally legal, if we're thinking about, what each state says, you might see that some states you need a medical card, some states you can go into a dispensary and buy anything you want. Some states you can find, CBD on a grocery store shelf. Some states you might not see that. And so one of the only states that really at this point goes fully against, not fully rather, but goes quite against what a lot of the Farm Bill has to say is Idaho. And so Idaho says, at least as per early 2023, so by the time you're watching this, maybe it's possible that it's changed, because things change in cannabis overnight, literally. But with Idaho now, they have very firm legislation on that there can be CBD products that are sold. However, they can have only 0% THC. So what that really means is that Idaho does not allow any products that are full spectrum, because as we saw, full spectrum means up to 0.3%. They only allow CBD isolate or broad spectrum products. What I did not include on the slide, which is also important to mention, is that there are certain states that are trying to keep all of their growing of cannabis and then therefore their selling of this cannabis that is grown within state lines. And again, this changes every single day, not every day, but it changes really often with what states decide and how states decide to go about their cannabis and CBD legislation. But I know, like, for example, Massachusetts, up until very recently, and I think it still does remain the same. It's a lot to stay up on all these legal updates and everything, but Massachusetts is very particular in that if you are a Massachusetts CBD brand, you are to get your CBD or your cannabis from a supplier that is Massachusetts local, and you can only sell your products within Massachusetts. Again, Every state does it a little bit differently. So if you want more information about that, I would look into, your local representatives and see what the recent legislation is. And if you have any questions, of course, please reach out to me, and I'm happy to find and send over the most recent information your way as well. All right, so number 9, there could be drug interaction. So this is, as a pharmacist, as a healthcare professional, this is one of the most important things that I find that is often missed in the cannabis discussion, because I do think that cannabis and cannabinoids and everything could be a great fit for a lot of people. I don't think it's a panacea, and I don't think it's going to be the right fit for everyone. And this is really important for me to say. And sometimes people in the cannabis space look at me sideways because they're like, but you're a cannabis expert, like you're a medical cannabis expert, like shouldn't you be, making or saying things like everyone should use cannabis? And I absolutely do not think cannabis is for everyone. I do think that depending on what drugs you're taking currently, depending on certain aspects of your lifestyle, like there are certain things that might not be the right fit for you. But I think as an integrative pharmacist, what's really important to me is that, maybe if someone comes to me and they're like, I'm taking valproic acid or Depakote, or I'm taking warfarin, and I'm really interested in taking cannabis, to me, these 3 medications on the right side of the screen are an automatic red flag and an automatic no for me, because to me, I'm always looking at the benefit to risk ratio and how can I decrease the amount of risk while increasing the amount of benefit for every single patient. And to me, using cannabinoids and using them in combination with any of these 3 medications, to me, the risk outweighs the benefit, and therefore it's not a good choice. But as an integrative health pharmacist, if you come to me and say, I'm having sleep issues and I really am interested in taking something natural, then I can point you to a lot of other herbs and supplements that could be a good option for you. But I don't think cannabis or CBD or any cannabinoid related product is right for you, because it's just the benefit does not outweigh the risk. And that's, to me, at the end of the day, every single decision for a patient needs to come down to that ratio. And so this other pie chart that I have on the screen is really important, because this pie chart really shows you that the breakdown of a lot of the medications on the market. So up to 70% of the medications on the market, so this is prescription medications, as well as supplements, as well as a lot of herbs, are broken down by this one enzyme system that is most densely populated or located in the liver or the intestines. So it's called the CYP450 system. And the CYP450 system is comprised of a lot of different enzymes. Some of these enzymes are on the screen in this pie chart. And so the thing to know about this pie chart is that cannabinoids, so specifically CBD and THC, where most of the research is, a lot of these cannabinoids are also broken down by these same enzymes. And the way that drug interactions work is that, if these cannabinoids are broken down by certain enzymes, and these enzymes also break down other prescriptions, then, these compounds are fighting for spots on the enzyme. And so that's what we don't want. We don't want like these different components to be fighting for a chance to be broken down, so to speak. And we need things to be broken down in the body for them to have their active effects. That's just the way that it works. So, if someone comes to me and they're on a medication that's broken down by CYP3A4 and 2D6, so denoted by the blue and the green on the screen, that's upwards of 70% of the medications on the market. Like that's a lot of medication. So it's really important to not just go try CBD products, but first talk to a healthcare professional that, we can talk to you about, is this the right choice? Maybe we need to select a product that does not have THC, because THC is mainly broken down by CYP3A4 and 2C19. Again, details as a patient that you don't need to know, but it's something that, we're here to help you and help you, figure that out and decide. Cannabis isn't going away. This is, one of the final points that I wanted to make, is that this is really key that healthcare professionals play an active role in this discussion. And also too, that, it's not just about the healthcare professional, it's also about patients knowing and being curious to ask the question. So we need patients to have the level of interest, which I think they already do. And as you can see, the CBD product sales have been increasing every year because people are curious, but I think that they're looking for the right resources and the right people who can teach them the information that they want to know. And then, the other thing I wanted to say about this as well is that, as I, hinted at before, I did not learn about the endocannabinoid system in school. I had to do additional training and additional certifications and everything. And I did it because patients were asking, and I wanted to be a resource for patients. And I wanted to be a trusted resource at the end of the day. And I wanted to feel like I really knew what I was talking about. But a lot of healthcare professionals, even now, it's not a mainstay part of the curriculum. So a lot of it, one of my biggest pet peeves is when brands or products say, go ask your doctor if you have a question. It's just most doctors right now don't have the answer for you. And it's simply because they were not educated in school about it. The only people who really know that are healthcare professionals have gone out of their way to educate themselves after graduating, after doing a residency, and finding out more information because they're realizing that these alternative healing modalities have research to support them and patients are interested. And if patients are interested, we as healthcare providers need to find ways to answer those questions. So that's nearly everything I wanted to say. I always like to put in this extra bonus because only 10 things about cannabis is so few things. So I just wanted to add this little bonus and then we'll open it up to questions. So cannabimemetics is this phenomenal kind of subsect of the cannabis, world and cannabis research. It's one of my favorite topics, so I can't do a whole lecture on cannabis and not talk about it. So cannabimemetics is really this idea of these different practices and foods and exercises and things that we do in our daily life that can work with the endocannabinoid system to have this benefit of decreasing unwanted or excess inflammation and increase the amount of cannabinoids in the body. So again, these are the endocannabinoids like AEA and 2-AG in the body. And so this is for, different things that we might already do in our daily life, but also things that can really work to have what's called endocannabinoid tone or increase our endocannabinoid system functionality without even taking cannabinoids. So it's even more than just taking the cannabinoid. There's a lot of other things that we can do in our daily life. As you can see the woman on the screen, one of my favorite examples is a woman, here on the screen showing us exercise. So exercise is if you look at the biochemical cascade, a lot of what people talk about after they exercise or after they do like strenuous activity, they're like, wow, I have this runner's high. So that initial terminology actually comes from the biochemical cascade, where in the beginning of the biochemical cascade is the increase in anandamide, which is an endocannabinoid, also binding to the same receptor as THC, giving you the feeling of euphoria or feeling high, right? So that's where that initially comes from. But now the way that it's discussed is the, increase of endorphins, which is also true. If you look at that full biochemical, pathway, endorphins are a part of the pathway, but so are cannabinoids. So I always like to say the runner's high is more closely associated with the increase in endocannabinoids, specifically anandamide. So that's one example. This is also some other research by one of the leaders in the cannabinoid space about research that has looked at prebiotics and probiotics and their relationship with the endocannabinoid system. There's also research specifically about active components in matcha like EGCG and how that helps bind to one of the receptors in the endocannabinoid system, as well as echinacea, which is something you might have heard of. There's really great research to support its use in specifically preventing cold and flu, not treating it, but preventing it. There's also research here on the CB2 receptor and how it's also tied to other inflammatory markers. So it's really incredible how full circle this all is. And it's, as an integrative pharmacist, it's one of the things I love about the cannabis space is that it's not just about cannabinoids that we can ingest from the plant. It's also what can we do on the daily that has nothing to do with ingesting cannabinoids, but let's optimize the systems we already have through activities like, drinking matcha, taking certain herbs and also exercising. So that's everything that I wanted to say. I hope that I left a few minutes for discussion and for Q&A. And I'm always here to be a resource to everyone.
Thank you so much, Dr. Varanasi. That's some great information in there. And as I'm sure you can imagine, we have quite a few questions that came in, but I will pull out a few of them here
Okay.
and ask them to you. The first one is, I have bad joints, which is something that is, fairly chronic in our world here. Are there plants or plant-based products that you might recommend to help with joint pain?
Yeah, so joint pain is really interesting to me because joint pain is not just about the actual joint. It's also about what is underlying, what's the root cause of that joint pain as well. So the way that I like to look at things like joint pain is like it's not just about what you can actually actively put on, let's say like a joint or like your knuckles or something, right? It's not just about that. It's also about what can we do to get to the root cause and from a systemic standpoint. So there's two different sides of this. It's the localized side. So the localized side is like the part you can point to that really hurts. So let's say if it's your joint, your elbow or your knuckle or any joint that you might have. And then the other part is the systemic side. So the systemic side is, what can I take and ingest on a daily basis that can take it, and look at it from the inside. How can I deal with this issue from the inside, but then how can I also deal with it from the outside? So that's a big thing that I like to talk about is like, and a lot of the root of pain or inflammation, the root of pain is oftentimes inflammation or linked to inflammation. So I would love to look at herbs or, different things that could be incorporated into your daily life that decrease unwanted inflammation or act as an anti-inflammatory. So, that could be things like a cream with certain herbs, like for example, like I love a CBD cream, for example, that could be put on a joint directly. I also love like transdermal applications. Like I co-founded a brand and we have a transdermal patch that we've done clinical validation studies for, and I feel very, very comfortable and excited about that product that we launched last year. So that's another way too. There's creams. There's also transdermal patches that are really wonderful, but we can't just look at, pain of any kind as something that's only external or only something that is localized. It's really about how do we approach something from the topical or right on top of where it's hurting, but also, what can we do internally? So to me, it would be, incorporating any sort of, and I would love to talk about this offline too, to understand more from a patient standpoint, like what exactly are you experiencing and what else have you tried? Because I don't want to recommend things that you've already tried. So I would say that would be one of my top recommendations is let's put something on top of it, directly on it, that's cooling, that's soothing, that feels amazing, that relieves some of that tension. But let's also, let's think about our diet. Let's incorporate herbs like, curcumin or like turmeric, which the active component is curcumin, but other, components like cloves. And let's look at, other aspects of our nutrition that can also work to, in the long term, decrease our inflammation. So it's a really multi-pronged approach of figuring out what we can do in the short term with putting something right on it. But then in the long term too, like what we can do on the daily to help decrease that inflammation through nutrition and also through a lot of like mindfulness exercises and getting good night's sleep, of course.
Great. I think we have time for one or two more questions here. Another one that came in says, if I have comorbidities like heart disease or diabetes, is cannabis an option for me?
So it could be an option. It is all about what medications you're taking. So if you are taking certain medications, I would prefer that person look to other herbs or other options. But it really depends. It's a very patient specific question. I have a lot of patients who come to me with comorbidities. I mean, I feel like at this point in our age, it's very normal to have comorbidities. So don't ever feel bad about that. It's really just trying to figure out, is cannabis the right fit for you? And just because you have one condition over another doesn't mean that cannabis could be out of question. It's more of what specific medications or even specific supplements are you already taking that, and then also looking at, are these are these medications working for you? Are these supplements working for you? If they're not working, what can we do to replace them with cannabis potentially? But it all comes down to a personalized look at what the patient is currently doing and then how I can work with that.
Great. Let me ask you one more question here that came in. Do you have any suggestions as to a place that we can learn more about cannabis or the cannabinoid system?
Yeah, definitely. So one of the things that I'm really proud of is I recently launched the first ever consumer specific course. And I'm just shocked that there isn't one until a few months ago that I just launched it with my brand. We have a course that's self-paced, multi-module, all about the endocannabinoid system and really the history of it. So delving a lot more into the one slide that I had, and then some of the use case scenarios, some of the dosing strategies, and then also at the end, like a quiz to evaluate, your competency in the information. And then also along with that, I do live webinars. I do a lot of live Instagram things to really benefit and supplement that information too. So I'm happy to send that over to the NHS staff and they can disseminate that information.
That would be wonderful.
Yeah, sure.
You can shoot it right over to me. So
okay.
I don't want to take any more of your time. I know we're over time here, and I really appreciate everything that you've done for us. But I just want to take a second to thank you for joining us this afternoon. We appreciate your time and your expertise, and I want to thank everyone else for being here as well too. Please note that the recorded webinar will be available on Friday, April 21st at hemophilia.org under the events tab with our other archived webinars. Thank you again for joining us. Dr. Varanasi, thank you so much for this. It was just a great presentation, some great information.
Oh, thank you so much for having me. And please, I'm actually going to put my, let's see. I don't know if I can put my email in the chat, but that's fine. I will send it over to you, Brett, and you can disseminate that as well.
Absolutely.
Yeah, thank you again. Great presentation.
Yeah, absolutely. Thank you so much.
Thanks.
Have a good day, everyone. Thanks.
Bye-bye.
Doctor.